jingle there. So let's see. And I know that was kind of the focus of this call. So hopefully Joe will be with us in a minute. But are there some kind of other things we want to cover, or at least kind of lay out, Carolyn, if there was anything in particular you're wanting to make sure we cover with the home care nurse? And I'm also curious, Carolyn, were you on the call when I did the presentation about?
Yes. Yes, Molly. Yep.
Oh, wonderful. Okay. All right.
So why don't I sort of, Molly, this is Roberta. Why don't I give an overview? Following that meeting, we had conversations with our home care agency, Kathleen Norton, and Caroline is the director of that program, and really had additional questions about the types of things the home care partner does on the team, what kind of advice they're giving, what their role is, what are some examples, what are some ideas. So that's kind of somebody just joined? Nope. Nope. That's kind of my sort of an overview. And Carolyn?
Yeah, and Molly, one of my concerns was in terms of the involvement of the home care agency, it was more.
Hi, this is Joe. I just entered this.
Oh, wonderful.
Hi, Joe.
Thanks, Joe. Okay,
you're welcome.
Carolyn, do you want to hold that for a second? And now that
Sure, go right ahead.
Yeah, let's go ahead and do some introductions, and then I think we can jump in. This is going to be a really fruitful conversation. So, okay, so this is Molly Dugan, SASH Director for SASH Vermont. Up here with me, I have Kirsten as well. Kirsten is doing our note-taking and set up the WebEx for us, so thank you, Kirsten, for that. Christy, do you want to introduce yourself?
Sure. My name is Christy Paleman. I'm a registered nurse. I work in two roles with SASH. We have a hypertension management initiative that I work with as part of my role, and then the other part of my role is working with all of the SASH wellness nurses throughout all the panels in the state.
Great. And I would just make a note that Christy, prior to being employed by SASH Vermont here at Cathedral Square, was a SASH wellness nurse hired through our local home health agency. So she's worn both hats. So I just wanted to inject that. Joe, do you want to go ahead and introduce yourself?
Sure. My name is Joe Haller. I'm a nurse with the Visiting Nurse Association Home Health Agency in Chittenden and Grand Isle counties here. And I work mostly in a territory of a city called Winooski.
And I would just add that Joe sits on the monthly SASH team that meets with the Winooski SASH panel and has done that for how long, Joe? How long have you been involved?
It's been 5 years.
5 years. Okay, great.
Yeah.
All right. So Rhode Island side, can we have you all introduce yourselves?
Yep. So my name is Roberta Merkel, and we're all with the St. Elizabeth community. Including our home care agency, which is a division under the name of Kathleen Norton Associates. We're piloting, for Joe's benefit and maybe the others, we're piloting the SASH program here at one of our housings in Providence. And with me is Steve Horowitz, who is the CEO of St. Elizabeth Community, Caroline Rumowitz, who is the director of the home care agency. And then we have in another location, our SASH coordinator, and a SASH nurse. Do you want to introduce yourselves? Are you there?
Yvette.
Yvette and Dana?
Yeah, hi. I'm Yvette.
Hi.
I'm the SASH coordinator here on the Rhode Island team.
Hi, this is Dana. I'm not sure if my sound is on. Can anyone hear me?
Yes.
Yeah, we can
hear you. Yeah.
Oh, good. Okay, so I'm Dana. I'm the SASH wellness nurse here at St. Elizabeth Place. Yvette and I are the SASH team in Providence.
Great. Excellent. Okay, so I think that covers everybody. Thank you guys for just doing that so we can all know who these voices are coming out. So so basically we wanted to take the time now to really kind of focus in on the role of the home care, skilled care, however that profession gets called in the different home health agencies, but the role of that professional on the SASH teams that here meet on a monthly basis, and that's that coming together of the SASH care coordinator, the SASH wellness nurse, and any of the other professional staff from the partner agencies that have signed on to be part of the SASH collaborative through the Memorandum of Understanding. And Joe, just so you know, I did do kind of a general presentation to Carolyn as well as another partner in Rhode Island on, what is the SASH team and what's the purpose, that kind of thing. But it was very generalized. And one of the things that Carolyn and Roberta just thought it'd be good they had some follow-up questions, and it was really more kind of like, how does it really work on the ground? And they have some, specific questions that we realized would be best if they could hear, not just from me, but from, someone that has been in that role for as long as you have, being from the home health agency and sitting on the team. So either Carolyn or Roberta, do you want to, talk about your questions, and then Joe, we can start a discussion.
Yeah. You know what, Molly, what I'd like to do is maybe just ask Joe, because it sounds like, Joe, you're the person that's really intricately involved with this. Can you just kind of give me a description of, like, what happens with these monthly meetings? Is it discussion about SASH participants that would be your home care clients or other agency clients? Just kind of give me a rundown on what your thoughts are.
Sure. My experience has been when we meet for our monthly meeting, the SASH coordinator will have on her agenda a list of the people who are SASH participants who she would like to discuss that probably have a little more need than some of the other participants, or they've just been signed on with SASH, and the communication is mostly around what the home health agency is doing with that patient and what the SASH coordinator and the SASH wellness nurse are anticipating doing for that patient. So they've already gone out typically and done an evaluation of the patient's needs. And if they are on the home health agency end, then I describe what I have envisioned for this patient or what I'm currently doing. And also kind of a historical background on that patient, so that we all are kind of talking about not only what they've seen, but what I've seen, so we can kind of dovetail those together. From there, we really try to identify those plate pieces that are missing. So let me give you an example. So if somebody's been sent home newly diagnosed with diabetes, my job would be, of course, to show them how to make sure that they're using their insulin pens or drawing up the insulin, teach them about diabetes, how to manage it. But then the SASH wellness nurse could come. Yeah.
Could I just interrupt you there? When you say, of course, your role would be, could you clarify for us your role as a home care agency or as your role on the team? Because I think you're talking about your role as a home care agency at that point.
Right, exactly.
When you meet with the client?
Yes. So
just if you clarify it.
Sure. As a member of the team, I am trying to describe to the SASH team what I'm doing so that we're not duplicating services. And then to allow a discussion to find ways that the wellness nurse could support what I'm doing. And then after I'm finished with that patient, sort of that continuum of wellness care, after I've discharged the patient, so that I have a safe discharge plan for that patient. Did that answer your question?
Well, my question is, and I think this is from the team perspective, would you be discussing, because there must be multiple SASH participants, would you be discussing SASH participants that you do not have on service as the home care agency?
I would not be discussing that. No.
So how does that work?
Yeah, sure. If that becomes part of the discussion, if a SAS participant is not somebody I have on as a home health nurse, then we would probably discuss what is going on with that patient more of in a overview, since I wouldn't know that patient, and perhaps I can impart some of what I've done in the past for patients who are in similar situations, or help the SAS coordinator direct the patient to asking the correct questions of their physician in case there really should be a home health agency referral.
Well, would there be, maybe this is another part of it, on this monthly team, do you have multiple agencies in there, if there's multiple agencies within the individual building?
Within this group, there is not another home health agency that does the same work, but there are other agencies like there is some social work agencies that do sit in on the board, on the team as well. But my role does not have a counterpart in that
so you're just
meeting.
So you would serve as, well, actually, let me ask another question. Do you find that the majority of the SASH participants, actually, how can I say this? The SASH participants that are on this watch list or that want to be discussed, are the majority of them receiving home care services, or is it more preventative, or is it a mixture of both?
I would say it's a mixture, and then on the other end is this, typically the SASH participant that we're talking about has in the past been on home health, on my home health list. So I've worked with them typically in the past. Or the other thing is this participant is starting to, the SASH coordinator and the SASH team have identified that patient or that participant as somebody who may end up getting a referral, and it's sort of a heads up on my end.
Okay. So
this is Christy. Can I add something to that as well?
Oh,
I've sat on a bunch of SASH teams as the SASH wellness nurse, and the other thing that has happened is we may also have the home health nurse, the home health skilled nurse, be ready to discharge somebody who they think is a referral to SASH, and so that has also happened as well. So they will, not disclose PHI, but have a discussion like, heads up, we're going to refer somebody to you guys. And then that person, gets into the system, and then we start to see them, not together, but jointly in terms of getting them admitted to SASH, and the the home health nurse is then working through discharging that patient. So that's another way of having that sort of discussion on the SASH team as well.
So Christy or Joe, this is Roberta, if a SASH participant at our St. Elizabeth Place has a home care agency that is not the home care agency on the team, for example.
Yeah. Okay.
I think I heard Joe say that they would still be a part of that discussion, and maybe a little more clarification on how that would be managed if there was another home care agency, but not that care agency is not a team member.
I can offer that explanation. So yes, our situation in Chittenden County is that the Visiting Nurse Association is the partner that sits at the table every month. Now, there is a competing home health agency in the area. It is Bayada. Occasionally, patients are on Bayada. So how do we resolve that? What we have done is we have gone back to the individual participants and shared with them, and it's their choice, right? They have a choice of home care agencies. And so we'll say, we'd like to be able to collaborate with your home health agency. Can we have permission to speak with them, and vice versa? And they will be added to the use and disclosure, and the participant will sign off on it. And then if we have a monthly meeting, we may say, hey, come to the beginning of the meeting, we'll talk about your participant first, or come to the end, or, you set up a special meeting. Whatever works for the team at that point with that agency, depending on the volume too. I mean, I'm talking like, just a couple of patients here and there.
Mm-hmm.
So if, and I think one of the issues that we have is right now, like our home care agency doesn't have any clients in the building. So
okay.
How would you see our role in that particular vein?
Do you guys want me to continue? Because I can answer that if you want.
Sure.
Yeah.
So if you are the partner who sits at the table every month and you're part of the use and disclosure, the way that I have utilized my home care nurses is to say, like Joe said, here's a new participant, or maybe it's somebody who's like, they've just gotten more frail, and here's a situation, and we start talking about it. And the home health nurses' knowledge that they impart to us is typically asking questions and trying to figure out, is there a skilled need there? And then how do we, then communicate that skilled need into the primary care office to get the referral going. So that's how I've utilized them in the past. And then the other key that Joe hit on was, if it is someone that they have seen in the past, having some of that history is really great, because they may have some information on something that worked for somebody, historically, that we could then go in and reinforce so that they don't get into a jam.
So if, like, say you had a client and that actually makes sense. So, you're talking about the client hypothetically, this is what's going on.
Yep.
The home care nurse might ask, well, like, what's the, is there a strengthening issue, gait disturbance, trying to find what the skilled need is, the skilled
exactly.
Does the SASH nurse then reach out to the physician to call in an order for skilled care, or like that? I think that's where I'm like.
Yes, we have. As the wellness nurse has then provided their assessment and their information into the primary care. Now, where that gets sticky, as we know, is how long has it been since the primary care saw the patient? So they might need to see the patient, which is fine. We'll help get that coordinated as well. And so that's how we kind of start that ball rolling.
So this is Roberta again.
Yep.
Could there be a situation where you're going through, the SASH coordinator and nurse have 6 people they want to talk about, and is it possible that the home care agency may have no input on anything because there's not a skill need, but they may offer something if they were part of the discussion? So they're still part of the discussion, even though there may not be a skilled need. They're still at the table.
Right.
Yeah.
Exactly.
So Christy and maybe Christy and Joe, so like if say you took those 6 patients or participants that Roberta's talking about, and they had 3 of them had another agency that might not necessarily be at the table, and there's recommendations that are made, does the SASH coordinator then refer them to the participant to let the agency know? Like, that's where I'm seeing a little bit of the disconnect. Like, if that agency isn't at the table, how do they get that to, like, I like the idea of the whole, ask if they have an agency and would they like to participate, because then it would actually be a consultative discussion,
Correct. Yes.
Like, how would that happen if the other agency, or is that just a standard the other agency would be asked to be in?
They would go back and get the release
from the client.
Are you talking about if? Yeah. I mean, if the patient has worked with an agency before and they're like, hey, I absolutely love this other agency, it's who I've always gotten my home care from, then I mean, and here's the other thing that we have done, and this has worked really well, is when you know that an order is going to potentially come, we give the home health agency a heads up as well. So if the patient says, I love ABC Home Care, we can call over there and say, heads up, we may have some information coming through for you and a referral. And that's all you have to say. you've gotten them, of course, signed off on the use and disclosure, of course.
And you say that you're talking about the wellness nurse doing that.
Yes, because the wellness nurse has her assessments that she can relay, as well as the additional information she has learned from the SASH team meeting. And really, the physician office wants to hear from the wellness nurse. They want that piece of assessment.
So can you also help us understand, Joe or Christy, when the home care agency has direct contact with a resident of the housing, am I correct that it's only when they contract separately for services? Other than that, there's no face-to-face with the client?
That is correct. I wouldn't be involved unless that patient were had contracted with the agency I work for.
Right. Okay, so you would be at the team meeting and you would be part of discussions, but if there was no skilled need or the client chose to another agency, all of that coordination would be done by the SASH wellness nurse. And then if the participant said, I would like to try a new home care agency, then that's when the intervention could happen or happen?
Yes. Yeah.
Correct.
Yeah.
Okay, and then if, like, say one of the recommendations was to refer for like social services, like community-based, does that, Joe, does that just go to your agency and then you bring in your social worker and get them set up?
That's right.
And if there was
Yes.
a client that might not necessarily be on skilled services, but may be eligible for home and community-based, maybe personal care visits and whatnot, who initiates that? Like, because that, hypothetically, I would guess that could be part of the discussion, this resident might, need a little bit of help with some homemaking and home care, but like in Rhode Island, you have to, you're going to need, like if it's like on our skilled services, social work and then worker in and they get it going. Like, how would that work with members of the the SASH community? No.
So that's again where the wellness nurse or the SASH coordinator would make that referral through the doctor's office.
Okay. Yeah. All right. That's all I wanted to know. Okay.
Yeah.
Yeah, and this is Molly. I would just say that those kind of conversations go on all the time at these SASH team meetings about, somebody needing some home care. Housekeeping or personal care. That happens all the time. And the coordinator and the wellness nurse, get really good at, figuring out the quickest way to connect someone. And there's lots of different organizations that provide personal care. Like if we take that as an example, beyond Joe's organization, which does a fantastic job with that. There's many other organizations that do. So, the SASH coordinator and the wellness nurse really, know how to talk to the participant about that, tell them what their options are as far as different organizations that do that. And a lot of times the participant, has history with, one of those organizations and they decide to choose that one. So those are very common conversations.
I was just going to say, and Joe, with your role now, are you a visiting nurse, so you actually have a patient assignment and this gets fit into your schedule once a month?
That's correct. Yeah, exactly like that.
Okay.
Yep.
So I'm thinking we belong, and this has nothing to do with SASH, but maybe the analogy would be helpful if I'm on the right sort of wavelength here. We belong to an organization where a lot of home care agencies, skilled nursing, adult day, have come together and formed this organization, which provides us with a variety of services, including group purchasing. So those of us individual agencies that sit on that board, when we go to that board, we kind of have to put our hat of St. Elizabeth off and we put on, it's called CareLink, the CareLink hat, because we're board members of CareLink, which provides those management service services like group purchasing. Is that like an analogy to what the home care and even the mental health center does. When they come to the team, they sort of put their hats a little bit aside of their agencies and bring their skill set to the team? Or is that,
Roberta,
am I off base?
Yeah, that's exactly how I see it working. That I mean, I think you've hit the nail on the head on that one. We're really just trying to collaborate about the services that this patient, this participant may need, and who would be tapped into best. And the SASH wellness nurse and the SASH coordinator are really the ones who would help corral all of those possibilities and reach out as necessary.
Okay, thank you.
It's a very good analogy, Roberta, because we often say, when you go to a SASH team meeting, one that has been, a team that's been together for a while, you walk in and you would think they all work for the same organization. I mean, they're focused on the mission, they're focused on the person, and it's not, you don't notice the fact that they are from separate organizations.
Mm-hmm.
Okay. All right. So basically, when you pick those 6 members, you're looking at each one as an individual case study, and everybody's just chatting about it as to what you're going to do.
Yes.
Up to the listeners.
Okay.
And the people that carry out the work that comes out of that case study discussion are the SASH wellness nurse and the SASH coordinator.
In general, yes. Now, if there's something specific to somebody I'm already working with, there might be some tasks, some tasks that I would take on, and I would, of course, put that on my to-do list, and then somebody else who is already involved with the same participant may say, well, I'll take task number 3, and then the wellness and coordinator would then try to find out who could take task number 2 and make that referral.
Yes.
So say, for instance, we have somebody who, on top of some other disease process, has been hoarding, and we need to find a way to help a one-time clean out that patient's place.
What if you need a 2-time clean out?
Yeah, we've had lots of wellness coordinator. I mean, the SASH coordinator trying to find a volunteer group or some neighbors who are willing to help out.
Yeah. Do you ever have a case, an instance where you would put from a home care agency a nurse? Could you use a nurse and a physical therapist interchangeably?
On the team, do you mean?
Yeah.
That's a great question.
Yeah, that is a good question.
I mean,
I think that, sometimes what we get into is the chronic disease management aspect of things. The transition of care where you're doing med reconciliation, that's huge. Wound care has been a big, big area of wonderful subject matter expertise from the home health nursing team.
Okay.
And I would just say, this is Molly, there's nothing, the way our use and disclosure is set up, it lists organizations. It doesn't say Joe from VNA of Chittenden and Grand Isle County. It is Joe that we know that comes to those meetings, but if it's, if something comes up and it's appropriate that, the social worker is also coming to the next team meeting because, they all know they have to talk about a tricky situation, that's completely fine for that person to also come, or a physical therapist. I don't think that has happened very much as far as the physical therapist, but I do know that social work case managers from our VNA have definitely come to SASH team meetings.
So in that example that Joe gave of a resident who is hoarding, it happens to be a situation that the place is dealing with right now, but the person is has refused to become a SASH participant in our situation. So the place is dealing with that. But if that person were a SASH participant, it could be that the Providence Center, the person who comes to the meetings regularly, is not the person who has that subject matter expertise, and they may bring somebody else in to help about what things they might do around hoarding.
Exactly.
for example.
Yep.
And if the social worker or if the home care agency had experience with hoarding, you might bring somebody in, kind of a thing.
Okay.
Yep.
All right.
Does our team have any questions in Providence?
No, this has been helpful in terms of thinking about the meetings, which we haven't held a formal one yet, and which we're looking forward to doing.
Good. Very good.
Great.
Okay, great.
Thank you.
It's been very helpful.
Thank you.
Good,
Thank
good.
you, Joe. Thank you,
Thank
Chris,
you.
Yeah, you're
Molly,
welcome.
and everyone.
Oh,
you're
We appreciate
welcome.
it.
I'm glad
Enjoy
we
the
finally were able
weekend.
to do this. Yeah, thanks so
Yeah.
much, everyone.
Thank
Bye,
you.
everybody.
All right, take care.
Thanks.
Bye-bye.
Bye-bye.
Thank you.
Bye, Joe. Bye, Joe.
Bye-bye. Thank you.